Hello and welcome to webinar series. Shanti here this side, and for the past 3 years, our webinar have been committed to empowering outreach and nurses all across through knowledge sharing. Thank you all for your continuous support and coordination and participation as well. Now, today's topic for webinar is all about on gallstones. As we know, the gallbladder may be small, but its clinical impact is very huge. So, for this discussion, and now we invite our expertise, none other Dr. Pavan Garu, who is our senior consultant surgical gastroenterologist, hepatic and robotic laparoscopic expertise from Yashoda Hospitals, Somajiguda. I welcome you, sir. We are honored to
Thank you,
have you with
madam.
us.
Yeah.
Thank you, sir.
Thank you, madam.
And now I request all the speakers to introduce yourself. Yes, Triveni, over to you.
Good afternoon, Honorable. I'm Triveni, working in Yashoda Hospital, Somajiguda. I'm glad to be part of a webinar. Thank you, Shanti ma'am, for giving this opportunity. Over to
Thank
you.
you. Thank you, Triveni. Yes, and yes, Sujata, over to you.
Good afternoon, everyone. First of all, thanks for introducing myself. I'm D. Sujata, present working in Srimarthi Hospital, Tirupati.
Thank you, Sujata. We welcome you, and I welcome Triveni also. Okay, let us see what we have in the rest of the session. Yes, sir. So yesterday, when I was just going through this citing article from NIH, and just very surprising to know that we are seeing a global, rise in gallstone cases. So we wish to understand your opinion on the same, sir. Over to you. Is it true?
Yeah, gallstones incidence has been increasing of late,
Yes.
mostly because of the lifestyle changes, what we say. Mainly two things. One is the diet and second is the activity.
Okay.
So these are the problems. The gallstones usually increase with increasing age, and we see more and more of them in women, not because of that's more because of the hormonal problems. The main reason for gallstones, as you know, is around cholesterol stones. Liver is in the center of the fat metabolism for the body. Whenever the fat enters the body or leaves from the body, it's through the liver. And when the liver is actively excreting fat, gallbladder is just a reservoir, stores the bile in between the meats. When the concentration of the fat increases in the bile, then they start precipitating. So typically what happens is patients who are taking more refined diet, more calories, less physical activity, and irregular timing for food, especially when they skip the breakfast. These are the risk factors which usually lead to stone formation. And the incidence, because these factors are increasing because of the stressful life and then irregular food habits, more refined foods, junk foods, this incidence is also increasing.
Yes, thank you, sir, for your very productive awareness on the same. And I now give this, opportunity to Triveni to just wish to what you wish to ask from sir. Yes, over to you for your presentation.
Gallbladder stones formed within the gallbladder out of the components of bile due to accumulation of the cholesterol and bilirubin or calcium in the bile. I wish to know your insight how our gallbladder stones are formed.
Madam, majority of the gallbladder stones are cholesterol stones. These are basically mixed stones. Yes. There are three varieties of gallbladder stones. One is pure cholesterol stones. Second is pure bilirubin pigment stones. Third are mixed stones. Mixed stones are the most common because these are the base of the stone is the cholesterol. Basically, these form the majority, 90 to 95% of the gallbladder stones. Only 5 to 10% of the patients who have hemolytic anemias, where the blood gets destroyed, more unconjugated bilirubin, those patients develop pure pigment stones. And majority of the cholesterol, because as I told in my previous discussion, this cholesterol stones, because they precipitate because of the hyper concentration of the hypersaturation of the bile, and the cholesterol in the bile gets precipitated in the gallbladder. Normally in the liver and the bile duct, there is flux of the bile. The movement of the bile is there. The gallbladder function is to store the bile between the meals. Suppose the cholesterol concentration is more in the bile, or if the duration between the meals is more, that means the stasis, gallbladder stasis between the meals, the timing is irregular and prolonged periods of fasting. What this happens is there's prolonged time for the bile to precipitate in the gallbladder. So most of these stones are cholesterol stones on which the pigment layering will be there.
So, sir, here I wish to know, like a person who presents with a lipidemia or cholesteremia. So, likely the patient will be inviting himself for this kind of conditions, sir, as you said, like cholesterol.
Hyperlipidemia. Yeah. Hyperlipidemia patients who have higher blood cholesterol tend to have more gallbladder stones.
Yes.
But if it is well controlled and patient is sticking to the proper medications, anti-lipid drugs, and then properly sticking to his meals, diet control, regular physical activity, stones can be avoided in these patients. Majority of the patients, when we see with gallbladder stones, they do not have hyperlipidemia. It's more of, it's not that the cholesterol levels are more and then the gallstones are happening.
Yes.
Those patients who already have high cholesterol levels, they're at a higher risk of stone formation. But if you see the majority of the population, we see in 30s and 40s, these patients, they develop stones mostly because of the lifestyle issues. It's not the hypercholesterolemia. It's not the more cholesterol in the blood. It's more cholesterol in the bile.
Bile.
Prolonged
Yes.
stasis. That's what is happening.
Yes. Yes, Triveni. Yeah.
This is the risk factors of sometimes we're seeing above 60 years age,
Yes.
obesity, rapid weight loss. What are the risk factors of gallstones, sir? Over to you.
As I told madam before, the liver is in the center of the fat metabolism. As I told, fat enters the body or leaves from the body, it's through the liver, and this the excretion is into the bile. The cholesterol excretion is into the bile. So with patients who are obese, or the flip side, those patients who undergo rapid weight loss, they start losing the liver starts metabolizing the cholesterol from the body. There, the cholesterol saturation in the bile increases, and then precipitation happens. The same goes with the diabetes also. These patients tend to have a higher incidence of fatty liver in these patients, and then more cholesterol in the bile. The second important thing is with age, the incidence of gallbladder stones increases. Patients who are in the people who are in the 20s or 30s is around 10 to 20%. As the age increases, 40s, 60s, it goes up to 30% of the patients. It's because of the gallbladder is a vestigial organ. The contractility is lost over a period of time. Younger, the gallbladder contractility, where it contracts and actively excretes the bile. That contractility is lost with time. So as the age increases, the incidence of gallstones increase. The third is gallbladder stones are more seen in women, mostly around the pregnancy time. As we know, estrogen is a smooth muscle relaxant.
Yes.
And if you take this birth control pills or patients who are pregnant, these patients, they have higher estrogen levels, causes smooth muscle relaxation and more gallbladder stasis, and then lead to gallbladder stone formation in these patients.
So I think we go with this classification, classic factors, female, fertile, fat, yes. And sometimes
Exactly.
this has been asked
also. It's a classical description of the gallbladder stone
patients. Yes.
Yeah.
Very great to understand. Yes, yeah. Sujata, over to you.
Sir, can you tell me the symptoms of the gallstones? Suddenly onset of intense pain in the upper abdomen that may radiate between the patient's shoulder barriers of trip of the right shoulder. Pain is associated with the restlessness, inability to still symptoms of nausea or vomiting. Pain usually common.
Yes, I'm trying to help Sujata by saying this, that are these the patient presents with sometimes they may present with these symptoms, or they may not present with these symptoms. So classically we wish to understand from you, because you are the expert and you treat a lot of your patients. Yes, over to you, sir.
Yeah, madam. If you broadly divide patients with gallbladder stones based on the symptoms, they go into three classes. You say one is asymptomatic stones, those patients who incidentally we find gallbladder stones in routine health checkup. Here stones are found, but patient doesn't have symptoms.
Yes.
The next stage is patients who develop symptomatic stones. Pain, the symptoms can be, it can be pain or dyspeptic symptoms. I will explain later.
Yes.
Usually the biliary colic, which we describe, patients with gallbladder stones, they complain of biliary colic, means these patients tend to develop an upper abdominal pain, mostly on the right side or in the central abdomen, especially after eating food, and especially if they eat some heavy meals like more oily foods and all, and more seen in the nights than in the daytime. These are the times when the patients complain of a sudden gripping type of pain in the upper abdomen. It progressively worsens with time. It's not like a kidney stone where the pain starts immediately and then it is spasmodic. In gallbladder stones, the patient pain is continuous, more slowly increases, peaks over some time, over 30 minutes, over half an hour to 1 hour, and then slowly comes down. This is a typical description of biliary colic. And when this comes, majority of the patients go for a scan or seek the medical help. But the second subset of patients, majority of the patients, they tend to have only dyspeptic symptoms like bloating sensation, acidity, indigestion. So suppose someone goes to a party and have heavy diet and indigestion, that's not. But even if they are having indigestion, even if they're eating normal diet, which they're eating previously, which was getting digested, now it is not getting digested. This is the high risk symptom when we need to look for gallbladder stones. The third is some patients tend to develop complications. The first presentation itself is complication like a jaundice,
Yes.
pancreatitis. It's a severe excruciating pain with sepsis, fever, all these things. That is a complicated gallbladder stones. But the understanding is usually patients tend to develop symptoms first and then complications, except in certain high risk groups like uncontrolled diabetes and immunosuppressed patients where the first symptom itself can be a complication.
And as you rightly said, sometimes it is asymptomatic, and only when, during routine checkup, we tend to find out. Yes. So, yes, Triveni, yeah, you also said are these the early warning signs of, like, the warning signs of gallstones, as you rightly mentioned,
Early warning
biliary colic
sign.
pain?
Yeah, early warning sign is usually the dyspeptic symptoms, which we call like indigestion, bloating, heaviness, which we
Yes.
neglect. Patients neglect also thinking it is acidity. They take Pantocid or any acidity medicine, Gelusil, that reduces. The principle here is gallbladder and the duodenum, the first portion of the duodenum where the ulcer develops, is supplied by the same vagus nerve. So if you take the same acidity medicine, majority of the times patients do get benefit even if they're having gallbladder stones that is causing the dyspeptic symptoms. They take acidity medicine, it symptoms go away initially. This because of the masked symptoms, because the nerve supply to the gallbladder and the ulcer area is the same. So
Yes.
these are the patients who need to screen for ultrasound and then take a corrective action.
Yes. So, you brought it described as a symptomatic, asymptomatic, and dyspeptic.
Yeah,
Yes.
symptomatic is pain or biliary colic or dyspeptic symptoms. Third is the
Yes.
complicated gallbladder stones.
Complicated, yes. I'm just noting down because, yeah, rightly, we are getting updated ourselves as well. Yes.
Yeah.
Yes, Triveni, you wish to talk about this slide. Yeah, over to you.
So now only you told symptoms without symptoms. How can we detect the gallbladder stones like a blood test, abdominal ultrasound, endoscopic ultrasound, and magnetic resonance, ERC?
MRCP. Yeah, madam. The best and the
And now,
simplest, safest, and most effective investigation is a proper abdominal ultrasound. And this important thing is patient should get this ultrasound scan done when they are fasting, empty stomach. Fasting doesn't
Yes.
means total fasting is taking only water. Coffee, tea doesn't count as fasting, right? So patient should be in empty stomach because gallbladder should be distended. When patient is fasting, gallbladder is distended. That's the time when stones are visible in the gallbladder. So patient goes for an abdominal ultrasound scan fasting. That is the best and the safest investigation to diagnose the gallbladder stones. And
Gallbladder stones.
gallstones is one condition where ultrasound is safe. It is more accurate than CT scan. Those patients where their ultrasound is not picking up the stones, or if you suspect a complication in these patients, either it's a slipped stone or a cholecystitis complication, pancreatitis, that's the time when we go for other investigations, as you suggested, endoscopic ultrasound or an MRCP, magnetic resonance cholangiopancreatography. This we use selectively in patients where we suspect either we suspect stones and ultrasound is not picking up stones, or we know that the stones are there, but there are some complications. We need to actually see how to proceed with the management in these patients, how to treat the complications to get extra information more than the ultrasound. That's the time when we go for MRCP.
And ERCP criteria is when we, crash the stone, and when it is, involving the biliary tract.
Right. Now ERCP, after the MRCP came, ERCP is mostly therapeutic now. Diagnostic ERCPs are over now, right? ERCP, when we say it is because it's an invasive investigation, we do it only when when we know that there is a bile duct stone, we need to extract the stone. That's the time when we do the ERCP. The indication is patient who already has a gallbladder stone with bile duct stone, we clear it first with an ERCP and then do the laparoscopic cholecystectomy later on.
Later on. Yes, very interesting. Yes, and yes, Sujata. Now I think we were talking all about this, but then still a little bit of clarity, maybe age factor wise. Yes, Sujata, what you wish to ask?
Symptoms are who more prone to develop gallbladder stones above
More
40
prone.
years.
Yes.
More prone are with aging, increasing age, more patients tend to develop gallbladder stones. We think because of the age, digestion is reducing, but it may not be the so. Patients with increasing age, we keep thinking, suppose we are growing older and our digestion is reducing. That may be physiological, but there can be gallstones also, because with increasing age, gallbladder stones incidence increases. Patients who are more obese, who are more sedentary lifestyle, and more refined oily foods, these are the patients who tend to develop gallbladder stones. And especially women in the pregnancy age. These are the time, most of the times when gallbladder stones, when I see in the OPD, patients get diagnosed with gallbladder stones during pregnancy. They get an ultrasound scan for the pregnancy and then gallbladder stones are seen, or sometimes they develop symptoms also during pregnancy.
Pregnancy, yes.
Yeah.
Yes, so now the approach for the keyhole, yes, Triveni, the laparoscopic surgery, yes.
Yes, sir. In keyhole, cholecystectomy, the gallbladder is removed through a keyhole in the abdomen with the help of tiny video camera. What are the benefits of the laparoscopic surgery, sir? I wish to know your insight.
Madam, the principle in gallbladder stone surgery is we need to remove the gallbladder. Many patients ask me whether we remove the stones or the gallbladder alone. So the principle here is gallbladder is a vestigial organ. It is not working. The principle is when gallbladder stones form, that means gallbladder is not working. Right. So in this, we need to remove the gallbladder completely. That we remove it through keyhole surgery instead of giving an incision. If you have to, originally it was done some 20-25 years back with a subcostal incision. It's a right subcostal incision, open surgery, just below the right side chest. So because it's in the upper abdomen and it's a transverse scar, which is whenever patient takes a breath, it's a very painful thing. Post-operatively, pain is high and chance of hernias are more. So the advent of laparoscopic cholecystectomy, now it's a gold standard for gallbladder removal. We do it with laparoscopic cholecystectomy in those patients where the gallbladder surgery is more complicated, like as I told, complications like cholecystitis or patients who are having, like patients who are having liver problems and then like a chronic liver disease, hepatitis B positive, these patients tend to develop cirrhosis sometimes, and then they have gallbladder stones. There, robotic cholecystectomy also helps in these patients. Robotic cholecystectomy is the same minimal access surgery there, because robotic instrumentation gives much more degrees of freedom inside. Basically, the more precise control of the instruments, it helps us in doing the minimal access surgery in these patients.
So yeah, very interesting, sir. And I wish to, Triveni, you wish to understand
I have one doubt, sir. I wish to know your insight. After laparoscopic surgery, recurrently it will be happened, sir?
No, madam. In the laparoscopic surgery, when we do gallbladder removal, our intention is to remove the complete gallbladder without leaving any residual stump. Right. When we can establish this, gallbladder is connected to the bile duct with a cystic duct. If we remove it completely, the chance of recurrent stone formation is virtually negligible. Problem comes in patients, suppose we are operating for a complicated gallbladder stone like cholecystitis, where the dense adhesions between the gallbladder and the bile duct. When that's the time when, suppose for safety's sake, some portion of the neck of the gallbladder is left off previously. So this neck of the gallbladder starts to distend, cystic duct stems distance, and then stones may form in these patients. And it is in these subset of patients where I was telling in complicated surgery, suppose we were not able to access that, define the complete gallbladder laparoscopically, there the robotic instrumentation may help in these patients. So laparoscopic instrumentation is good. With increasing expertise, we can remove more and more patients laparoscopically, but there is a certain upper limit where beyond that, when the extra precision of the robotic instrumentation helps in these patients. So the principle is to remove the complete gallbladder. We remove some amount, leave some amount that will form another cystic duct stump.
Yes. So the complete removal is also not okay, and it is justified as per your decision making.
See, when we remove the gallbladder, intention is to remove it completely. The gallbladder, patients feel psychologically, why are you removing complete gallbladder? But it's like an appendicitis. Suppose someone young age, they develop appendicitis, we need to remove the complete appendix. Suppose they do not remove complete appendix, stump appendicitis happens. The problem in these vestigial organs, gallbladder or appendix, is there is no native immunity in these patients, in these organs. So we leave certain remnant in that. More often than not, they go into complications, like a residual recurrent stones or all these problems.
Yes. And yes, we have just come to the end of the session, and a few tips as a like prevention. As as you said, regular physical activity also is important, and few food factors, because maybe we don't know what are the little food factors to be avoided. Yes, over to you, and we end.
Yeah, madam. Food factors, basically, I suggest patients healthy food, healthy way of eating, and active lifestyle. This thing corrects most of the problems. Not only gallbladder stones, but also constipation, but also acid peptic disease, also obesity, hypertension, diabetes. All these conditions get controlled. What I suggest is patients not to skip breakfast. That's the most important thing which I tell them, because most important meal is the breakfast in the morning, and that's the meal which people neglect it. People take dinner in the night, and then throughout the night it's a fasting only. And if you skip the breakfast, that's the time when gallbladder hyper is, because the bile hyper concentration happens, acidic juice, more digestive juice in the intestine, all these things start to act upon the normal structures, and some ulcer disease comes, gallbladder stones come. So I suggest patients not to skip the breakfast. Breakfast is important, regular time for food, basically not to skip the meals. Suppose they're in a work pressure, doing some work, better at least to take some fruit or a biscuit or something, so that at least
Yes.
that fasting period is not prolonged. Second thing is to eat healthy diet, reduce the junk food, more refined, like you should take more fiber and
Avoidance, yeah.
healthy diet. That's what I suggest people.
Yes.
And along with the active lifestyle.
Yes, because nowadays the style is towards the gut health, gut microbiome, access to the brain health, and we see a lot of individuals that they do 1 meal in a day and intermittent fasting. I think
Right.
those are the little high risk criteria, maybe. Yes, and
Intermittent
yes,
fasting is good in patients who are planning to lose weight, but it has to be done under supervision. Like it cannot be
yes,
someone does a web search or sees online forums and then do intermittent fasting without proper guidance, proper dietitian or a gastroenterologist guidance. Then
yes.
it's a two-edged sword. Basically, it's a good thing, but body should be ready to accept the intermittent fasting. Best is
Thank
to
you for
screen
your
once to see if there's any problem, correct all these things, then go for it.
yes.
Yeah.
Okay, Triveni, you have any doubt, or Sujata, you have any doubt, because we are just going to end. Yes, Triveni, any doubt? Any doubt on that? Okay.
Yeah,
Okay,
madam.
so that was a very crisp and very, productive insight you have provided, and I've just seen your few podcasts and your short reels. They were all interesting, as you are the nurse's favorite and beloved. So
Arey,
yes, I urge all the nurses and the viewers to share this link, because, as Sir rightly mentioned, that these factors are very important. What should be the do's and don'ts? Because
yeah,
just browsing the Google content is not enough, and just chatbot and
yeah,
these AIs are just just keep this aside and just see what experts view
right.
is has to be seen. Yes, so I request all the viewers to just refer www.yashodahospitals.com for more health updates, academics, and also watch patient testimonial. And because it will give you evidence-based learning and information, because staying update is the the current era of the thing. Yes, sir. I thank you, sir, for your
Thank
valuable
you. I
time,
just,
and I thank all the speakers to be in the session. Thank
thank,
you.
Thank you, sir, for giving the information.
yeah, thank you.